Assalamualaikum and a very good day. I would like to welcome all participants to the concurrent session of our National Conference on Behavioural Insights 2021. We are in virtual room 3 and the topic of this session is about speak out, express your rights towards a smoke-free environment. My name is Mohamad and I will be your moderator for this session. The session is scheduled for approximately 1 hour, including the Q&A. The first part, the main part, will be the presentation by our speaker, and the second part will be the Q&A. Before we start, let me begin by introducing our speaker for today. We have today our special guest yang berusaha, Encik Wan Azrin Izani, Wan Mohd Zain, who is the Principal Assistant Director of Communication Mobilisation Branch, Health Education Division of the Ministry of Health. Mr. Wan Azrin, before in this current position, was the Director of Corporate Communications at MySihat. Without further ado, I would like to invite our speaker for today, Mr. Wan Azrin, to share his thoughts and opinions and his experience on the topic today, which is speak out, express your rights towards a smoke-free environment. Over to you, Mr. Wan Azrin.
Okay, thank you very much, Encik Mohamad, for the kind introduction. Assalamualaikum warahmatullahi wabarakatuh. Yang berbahagia, Tan Sri, Datuk-datuk, Datin, tuan-tuan, puan-puan, honorable guests, distinguished speakers and panel of experts, ladies and gentlemen. First and foremost, I would like to extend my sincere thanks to the organizer, especially MPC, and the Secretariat for hosting this event, which becomes an opportunity for me and the Ministry of Health to speak out about the given topic, which is Behavioural Insights, speak out for our rights towards a smoke-free environment. I will also like to take this opportunity to express my heartfelt gratitude and appreciation to the organizing team for making this event a reality, despite the stark reality faced by all of us, that is the pandemic, which is still raging on. There is a ray of hope in the form of a national COVID-19 immunization program, which has been kicked off, and hundreds of thousands under the phase 1 have been vaccinated. For your information, I have been assigned to the COVID-19 immunization task force, or CITF, who ensures the implementation of the vaccination program under the stewardship of the Special Committee for Ensuring Access to COVID-19 Vaccine Supply, or JKGAV, which is being jointly chaired by Yang Berhormat Tuan Khairi Jamaluddin, the Minister of Science, and also Yang Berhormat Datuk Seri Dr. Adham Baba, who is the Minister of Health. Now, back to my presentation. So what is the Speak Up campaign? The campaign was rolled out officially in early 2020 to empower the non-smokers to express their rights to clean air free of tobacco smoke and vape. If you remember that early 2020, the Ministry of Health has come out with has been given the legal provision and also the enforcement authority to enforce all eateries, restaurants and cafes to become smoke-free, which has been gazetted in 2019. So understanding the situation where we need also to empower the general public who is a non-smoker to voice out their right, rather than solely dependent on the enforcement and also the legal provision under the law. So there is a need for voluntary support and also from the public to express their support to this campaign by expressing their rights. So this campaign focuses on recruiting the general public to become the behavior change agents towards a smoke-free nation by the year 2045. Why 2045? This is our desire, but by 2045, Malaysia can become a totally smoke-free nation by having less than 5% smokers in this country. Why have I said about this? Other countries such as New Zealand, for example, they have, based on their experience, they manage to reduce the number of smokers to their country against population less than 5%. So, and even in countries close to us, for example, Singapore, they're having less than 10 or 15 or 10% smokers in their country. In Malaysia, we still have around 22 or 23% smokers among adults in this country. And this is not impossible. We all can do this together, despite the pandemic and so on. And we managed to stand and to voice to express our rights together, so Malaysia can become a smoke-free nation. The bedrock of this campaign is health promotion, and this complements the legal and also enforcement measures undertaken by the Ministry of Health to curb smoking in the gazetted public areas. If you know that we have around 22 to 23 public areas which have been gazetted under the law, including restaurants, R&R, sports facilities, government offices, buildings where they have the centralized aircon, for example. So all these buildings and premises have been gazetted under the law as no smoking areas. For those who are not familiar with health promotion, the phrase health promotion has been coined in 1986, which is being defined as the process of enabling people to increase control over and to improve their health as stated in the WHO's Health Promotion Glossary 1998. The first international conference on health promotion was held in Ottawa, Canada in 1986 and was primarily a response to growing expectations for a new public health movement around the world. It launched a series of actions among international organizations, national governments, and also local communities to achieve the goal of health for all by the year 2000 and beyond. The basic strategies for health promotion identified under the Ottawa Charter were advocate. The first one is advocate, to boost the factors which encourage health. Secondly, enable, which allows people to achieve health equity, and mediate through collaboration, networking across all sectors. So this is very important. And if you can see that the health for all has been set to be implemented by year 2000 and beyond, which is concurrently with firstly with the Millennium Development Goals, and afterwards followed by the Sustainable Development Goals. And these two initiatives runs together and complement each other. There are strategies which 5 strategies that are augmented by pillars of actions, which are building healthy public policy, create a supportive environment, strengthen community action, develop personal skills, and reorient health services. These pillars of actions are instrumental in building the smoke-free initiative. Yet after more than 30 years since the culmination of Health Promotion Charter in Ottawa, it is still relevant and will continue to do so in the future. It is also flexible enough to be interpreted in current times, even though the world has witnessed changes that come and goes socially, economically, and politically, even in Malaysia. The 9th Global Conference on Health Promotion 2016 proclaimed the Shanghai Declaration on Promoting Health in the 2030 Agenda for Sustainable Development, This declaration outlines the focus towards creating cities that are livable for communities, inclusive, safe, and resilient. In the era of SDG, close interaction, partnership, and collaboration between health promotion players, health policymaker, local government, civil societies, and businesses are paramount in expanding the smoke-free areas, rather than focus solely on enforcement and also legal provision. All forms of smoking habit are dire to health, not only to the smokers, but also to the non-smokers who are exposed to the second and third-hand smoke. Besides, all forms of smoking habits are detrimental to the children and youth development because they learn through observation, as demonstrated by the groundbreaking study on aggression by psychologist Albert Bandura, that demonstrated that children are able to learn through the observation of adult behavior. If you can remember, you can still access the clip of this video, the Bobudol experiment, which has been carried out by Bandura in 1961 in the Stanford University. You can still access a few of the clips in YouTube or in Facebook that laid the path for the social learning theory. So this theory is one of the pillars for the health promoters, and also for psychologists, psychiatrists, and so on, because we are dealing with human behaviors. Reflecting our experience in Malaysia, the Smoke-Free Initiative is not a straightforward campaign whereby you can simply just enact a smoke-free policy or enforce the law and ask the police to remand people who smoke in the public areas. Eventually, the struggle is broader in pursuance of bringing the stakeholders together, facilitating the partners in mapping the plan of actions, building the network of allies, and the paramount importance of building the capacity of organizations, including NGOs, as well as empowering our general public to voice their rights for cleaner air. In the case of Speak Up campaign, the support from the population is important to deter smokers and vapers from polluting the air and from making the cigarette butts becoming an eyesore in our environment. As you all can see, that the secondhand smoke, or also popularly termed as passive smoke, is the smoke from the burning of tobacco products and the smoke that is exhaled by the smokers. While the third-hand smoke refers to the chemical residue of tobacco smoke contamination that lingers on in the space after the smoker left the place. I can give you some example, like the hotel room that allows the occupants to smoke, or a family member who smokes in the living room, in which the living room also being used by other family members after the smokers left. So most of the people know that in cigarette, they have more than 7,000 chemicals which are not needed by our body. For example, formaldehyde, tar, and so on, in which harmful to our health. And if you can see from the facts that 1 hour in a room with a person who is smoking indoor equivalent to 3 cigarette sticks. And just imagine we are living with a smoker in our house, or having colleagues in the workplace who smokes, who are not practicing where the workplace is not practicing a smoke-free policy. So this is very detrimental to our health.
Okay, what Azrin, if I can interrupt, you mentioned earlier a very interesting point indeed about the need to promote health, especially regarding smoke-free environment. You mentioned earlier about vape, yeah. Can you share a little bit whether the harmful effects of vape, is it similar to normal cigarettes or does it differ?
Okay, since vape is not regulated in Malaysia, and there's a lot of study still need to be done, but based on experience that we learned from other countries around the world, that vape is not it's not a measure for smokers to, it's not the most effective way for smokers to stop smoking. Why I say this? The only country which promotes e-cigarette, I don't say vape, e-cigarette, is only in UK, whereby the Public Health UK claims that through e-cigarettes they can, but we can still argue these findings from Public Health in England, because in many countries there are, for example, in several years ago, there are e-cigarette and vape that cause some problems to the disease, which we call popcorn lung, whereby the liquid nicotine, which is the second thing about e-cigarette and also vape, is that in Malaysia, nicotine is regulated under the Poison Act, and you cannot simply buy nicotine liquid at any store unless it is prescribed by the doctor or pharmacist, licensed by the government. So in Malaysia, I can say it's totally no to have vape or e-cigarette as a way to stop smoking. So in Malaysia, we have a lot of avenues where smokers can get help and assistance to stop their smoking habit. For example, we have 49 smoking cessation clinics in public hospitals, institutions, or which render the service for free, and you can get counseling and also consultation for you. And also we provide quick line for smokers to get help. You can just dial the number and get help. Other than that, the Ministry of Health also working together with the private sector, for example, the private pharmacies and also the private hospitals, to provide smoking cessation services to the local population. So I don't think so that in the near future that we really need to really make vapes or e-cigarette as a way to stop smoking. Just going through this community, the most important thing that you need to empower your willpower to stop smoking rather than change from smoking to vape. At the same time, we also have, there are some findings from study that some of the youth become dual user.
Okay.
They start with vape and they cannot get the kick.
Okay.
So they change to smoking, and later on they become vape and also smoke cigarette user. So this is really becoming a problem for us. So I really hope that the government will not support or in the near future to initiate to regulate vape or illicit products in Malaysia. So, but it depends on the government to decide about it. But there are so many, for the time being in Malaysia, there are not so many studies that can point out, but we can learn from many studies from outside, from the foreign countries, issues, for example, Ivali, the popcorn lung, and so on. So we really hope that it will not be regulated in Malaysia.
Okay, thank you very much, Mr. Wan Azrin. I think it's very, very interesting. You mentioned about the importance of self-control, because in Behavioural Insights, that is one of the key elements when we talk about behavior. About the self-control is one of the key issue faced by many humans. And like you said, switching to e-vape may not solve the problem. And yeah, so that's a very relevant point. And thank you for your response. Sorry for the interruption. Please continue with your presentation.
Maybe I can add on. People think that vape produces steam, which is looks like more eco-friendly, much cleaner than smoke. But eventually, you are inhaling the steam of liquid nicotine. If you smoke, that nicotine in the cigarette mixed with other things and they have filter. There is no filter in vape. You just imagine here the steam and also the flavor, whatsoever flavor, strawberry, musangking and everything. But still you inhale those, and that's why there's a lot of popcorn lung cases which the hot nicotine liquid invade into your lungs and causes damage to the air sac in your lungs. So this is very serious, and there's a lot of cases where people lost the ability to use their vocal cord and so on. So this is,
I see.
but I will not digress further on that. So let me continue with my
Yes, please.
Okay. So outreach and communications are necessary to build support for smoke-free laws. So while the public is generally supportive, a much larger proportion become strongly supportive with a communication strategy. So communication is very important. A communication strategy needs to be developed to ensure that most effective messages are delivered at the appropriate time through the most effective means to the people that need to be reached. A survey by the Ministry of Health in 2019 shows that more than 94% of the Malaysians think smokers should be reprimanded if they smoke in the public areas. Now, I will point out further, and later we are coming closer to the Behavioural Insights on the Speak Up campaign, the findings of the study carried out by MPC together with University of Malaya and supported by Health Education Division, Ministry of Health. And surprisingly, the majority of the smokers also agree if they are reprimanded at the no smoking areas. They also know, based on studies from the past, that more than 90% of Malaysians knows about the ill effects of cigarette. Many people know that in cigarette they have more than 7,000 chemicals inside cigarettes and so on. They know the harm of cigarettes, and it's not surprising that majority of smokers also agree reprimanded, because this is detrimental to health of other people. We have spoken about second-hand smoke and also third-hand smoke. So it is all right for us, all of us Malaysians who care, to voice our rights to the clean air and for the smoke-free environment. However, I will express our rights in a polite manner to curb the smoking habits by the smokers. Start with a good intention, choose the kind words, and express your concern in the polite manner, rather than harshly you go and knock somebody off the road, something like that. So this is some of the examples some of the messages that we have developed at the Health Education Division under the Ministry of Health. So, and at the same time, also next month we will come to the month of Ramadan. So during the early part of Ramadan is the Nafas Baru Permula Ramadan. So this is a good way of using Ramadan, the ibadah, as a way for you to curb and to stop your desire, your habit to smoke and so on. So use the fasting as a way to stop smoking. The COVID-19 pandemic has reshaped our views and helped us to increase our understanding of how our health is interconnected with other facets of our living world. Health is influenced by many factors, which may generally be organized into 5 broad categories, known as determinants of health: genetics, behavior, environmental and physical influences, medical care, and social factors. These 5 categories are interconnected. Here I want to reiterate that health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity, as defined by the WHO. On 31st of May last year, the Director General of Health, Tan Sri Dr. Abdullah, has pointed out in the World No Tobacco Day message that 86 cases out of 115 COVID-19 deaths in Malaysia at that time, where 19.8% were smokers. Smoking put the smokers at a greater risk of contracting COVID-19. To smoke, to start smoking, the smoker has to remove the facial mask, and the act of bringing the hand to the mouth increase the susceptibility of transmitting the virus to the respiratory tract. Those who are using shisha or vape may also be putting themselves in the way of harm because the similar action of bringing the hand to the mouth. And for most of the shisha users, they are sharing this apparatus, the mouthpiece, with other people who use shisha, for example. The rest you have already known that the fact that COVID-19 can cause lung complications such as pneumonia, and the most severe cases, acute respiratory distress syndrome or ARDS, sepsis, another possible complication of COVID-19, can also cause lasting harm to the lungs and other organs. In pneumonia, the lungs become filled with fluid and inflamed, leading to breathing difficulties. For some people, breathing problems can become severe enough to require treatment at the hospital with oxygen or even using a ventilator. So just imagine, a pneumonia, the pneumonia that caused by COVID-19 tends to take hold in both lungs. Air sacs in the lungs fill with fluid, limiting their ability to take in oxygen and causing shortness of breath, cough, and other symptoms. While most people recover from pneumonia without any lasting lung damage, the pneumonia associated with COVID-19 may be severe. Even after the disease has passed, lung injury may result in breathing difficulties that might take months to improve. So just imagine what will happen when COVID-19 virus managed to infiltrate the respiratory tract of the smokers and damage being done to their lungs, while their lungs have already been poisoned by all sorts of nicotine, tar, and everything. Just imagine whether their lungs will be capable of facing the challenges when being infiltrated by the COVID-19 virus. From the environmental perspective, the smoking habit contributes not only to the air pollution, but is also poisoning our marine and aquatic environment and later damage our food chain. So for business owners, which are also with us today, captains of industry, head of departments, and all the employers at large, smoking at the end of the day equates to the loss of productivity and indirectly affects the cost factor. The burden of diseases caused by smoking, either to the smokers or passive smokers, and the consequential diseases such as heart problem, cancer, and chronic obstructive pulmonary disease or COPD are among many health problems associated with smoking. The loss of income from medical leave or MCs and hospitalization will affect the life of the workers who are suffering health problems. Even the use of face masks, a simple example for today, the use of face masks that we take for granted eventually led to the increase of running costs for the employers who provide their workers with face masks for free. Smokers have to frequently change the facial mask due to the contamination, notwithstanding the cost of disposing the used mask that usually ends up in the gutter, drainage system, or sometimes just thrown away improperly. Just imagine the cost of cleaning the environment. And in the recent BBC news report, in Philippines, in Philippines, they have a lot of islands, beautiful tropical islands. So among the corals, there's a lot of face masks being disposed, found to go to the corals in this island. So you just imagine, and this facial mask is not easy to, it's not easily degradable. So it will take years or hundreds or thousands of years to rot away in the environment. So just imagine if you throw away the mask. It's not, and I have said earlier that the cigarette butts will go to the drainage system and later goes to the river and flows into the ocean and will damage our food chain because starting from the bottom, up to the fish and we who consume the fish that being contaminated by cigarette butts. So just imagine the poison that comes into our body from this food chain. So nobody wants to lose out in current economic climate. Look at the hospitality industry as an example. We can afford to look again at the closure of hotels and resorts that not only the workers have lost their income, but also the communities at large who are dependent on tourism. So the local communities in kampongs or in Langkawi, for example, they are very dependent on tourists coming to the island. If there are closure of hotels or resorts where these tourists need to get their accommodations and so on, yeah, we still have homestays and so on. But the community who offer services such as water ski, for example, they need tourists to use that, not the local people. So they're very much dependent on tourists who come to the island. So let us together make Malaysia as a smoke-free nation. So for smokers, I've said earlier, we warmly welcome you to get assistance by calling our quick line at 03 888 34400, or you can just walk to any smoking cessation clinic at selected hospitals all over Malaysia. You may also visit the website johnquick.moh.gov.my to get more information. Remember, the best remedy to stop smoking is your willpower. It's not the ajak kawan-kawan and so on. It's up to you. And use the ibadah of fasting during the month of Ramadan as a starter for you to stop smoking and for your desire to lead a healthier life for you and your family. So now we are coming to the second part of the presentation, which is the Behavioural Insights study, namely the enhancing awareness and empowerment of Malaysians on the effects of second and third hand smoke on health, the effects of message framing on awareness, psychosocial and empowerment of family members in relation to smoking behaviour. The study was commissioned by MPC in 2020 and implemented by University of Malaya, while the Health Education Division, Ministry of Health, rendered the assistance in the form of technical support and insight to the study. The objective of the study were to investigate types of messages that resonate with the family members related to second and third hand smoke effects on health. Secondly, to determine the level of knowledge, intention, self-efficacy, and empowerment of the family members using the message framing from the infographics, and to determine the level of exposure to anti-smoking campaigns by the MOH on the levels of knowledge, intention, self-efficacy, and empowerment of the family members related to second and third hand smoke effects on health. So I have defined what are second and third hand smoke in my earlier slides. In terms of awareness and behavioral gaps, it seems to be that the government has been proactive in driving the anti-smoking campaigns with increase on awareness, but the smokers are most likely undeterred. Or maybe I can use the word again. Besides, the campaigns may have a little effect on empowering the family members to express their rights. All this may be due to ineffective messaging and messages that rouse reactants among recipients rather than empower and making them believe they can voice their rights. I will skip the research methodology and design. You may read all this from the slides, and you can get a copy of this report, the report of this study from the MPC, from MPC. Now we come to the findings of the study and how they will help to improve the implementation of the Speak Up campaign or any anti-smoking campaigns to be carried out by any parties, or perhaps MPC who wants to have to build a healthy public policy in workplace. They want to introduce a no smoking policy at the workplace, for example. Furthermore, please take note that this study is only on the first phase, which focus more on the intention to voice out or expressing the rights of non-smokers. So we really hope that the intervention phase study can be carried out later this year by MPC with collaborators. So the main objective of the message framing is to enhance knowledge of the target group about the dangers of second and third hand smoke on health through underlying tailored messages. Second, respondents who preferred the infographics with emotional appeals tends to respond better to knowledge statements compared to those who prefer fear and humor appeals in cigarette smoking behavior. And thirdly, general self-efficacy levels for all respondents, regardless of choices of messages, message appeals, have the confidence to express their rights to family members about cigarette smoking. In comparing these three appeals, those who prefer fear messages have the least inclination towards self-efficacy. Respondents who favor emotional appeal messages have a greater intention as well as empowerment to express right to have a clean air from tobacco smoke. Fifth, message framing on health promotion materials and anti-smoking campaigns is seen as a cue to action for empowerment. This is what the health belief model says about cue to action, which is actually an exposure to factors that prompt actions to take place. And lastly, anti-smoking campaigns and health promotion materials that lack focus on message framing are seen as less effective to increase intention and self-efficacy, as well as to link to behavior empowerment. And finally, from the Behavioural Insights study, it is recommended that the health promotion materials related to anti-smoking campaign must be tailored and framed according to the needs of the target groups. And lastly, the emotional appeal messages must be given in the areas where they have more effects on awareness, intention, self-efficacy, and empowerment, and the message appeal must be suitable and relevant, which is important with the cue to action in the relationship between messages to enhance knowledge and actual behavior for empowerment. So we come to the end of my presentation. So with that, I humbly conclude my presentation with terima kasih and wishing you all a fruitful discussion and happy conference. Thank you very much. Back to you, Encik Mohamad.
Okay, thank you very much, Encik Wan Izani, for a very interesting presentation, a very important presentation which is relevant to our well-being and specifically about the health of our population, including those who are exposed to second-hand, especially those who are exposed to second-hand as well as third-hand smoke, as mentioned by Mr. Wan Izani earlier. So I think this is a very relevant, very important, should be of interest to everybody, especially those who care about the welfare and well-being of Malaysians, especially in the dimension of health. Thank you very much, Mr. Wan Izani. Maybe before we go on to end the presentation, take a short break, if I can just ask a quick question. You mentioned about the target groups in the study of the Behavioural Insights just now. Is this target group focused only on non-smokers, i.e. the public or family members, or does it also involve the smokers as well?
For this study, the target groups are family members who are non-smokers but having a family member who smokes.
Okay.
Or
okay.
If they are not family, they are staying together. For example, roommate,
housemate. Okay.
Housemate or hostel roommates who smoke. So this is because we want to test the message framing from the infographic, whether they can tend to let them to cue to action. So, so we found out it's going very interesting, and we hope that if we can, if the MPC have a more budget for to conduct more studies, we can go for the second phase, which is the intervention phase after we study.
Okay. Thank you very much, Mr. Azrin. I think that is a very, very interesting topic indeed. And he mentioned about the target groups, which is mostly family members who have among them smokers, as well as housemates, or people who stay together with smokers. And I think with that end, also the recommendation provided just now, that this is probably just one phase of the study, and there's the recommendation from the J1 Azrin and the team of the need to go forward with the next phase of the study, the intervention and all that. So with that, thank you again, J1 Azrin. We're gonna take a few minutes break. Thank you all participants who have stayed throughout the session. Please stay on. We're gonna start again in a few minutes for the Q&A session. Okay, thank you for all the participants who stay on with this session. We just had a session just now, presentation, a very interesting, very useful presentation by our representative, very important person from Ministry of Health, Mr. Azrin Izani, Mohd Zain, who has spoken about the importance for the public, for family members, for friends to speak out about their rights to live in a smoke-free environment for our own well-being and welfare. We have several questions coming in. Thank you for posing the question through the platform that we have provided. To J1 Izani, the first question is, I guess, about the role of employers, peranan majikan, because we know that many of the smokers are workers. Maybe they work in office, maybe they work in factories, or even those who work in the outside, outdoors. So there are various type of categories of employers and employees. And I guess it's quite common in our culture. From time to time, smokers go and take a smoke break during the work hours. So maybe if based on your experience, J1, if you can share maybe what is the roles, peranan, the role of employers in encouraging their smokers, to stop from smoking, or at least from preventing from smoking, from exposing other people to second-hand and third-hand smoke. Over to you, J1.
I have spoken earlier during my presentation, the early part of my presentation, that the bedrock of the Speak Out campaign or anti-smoking campaign is health promotion. And once you talk about health promotion, the most important part for the employers or business owners, or for the departments where we have head of departments, is to build a healthy public policy. The healthy public policy is not only a policy statement by the government, but also we can have an internal policy where, for example, during office hours, workers are not allowed to go in and out from the office every half an hour. You cannot have your smoking break, so that tend to curb. It will can be used to curb smoking. Secondly, please eliminate all smoking rooms and all smoking facilities. Because firstly, from the statistics in Malaysia, only 1/3 from our population are smokers, while 2/3 are non-smokers who suffers from second and third hand smoke. So as a minority from the majority of population, why we need to give rooms for a habit that will be detrimental not only for the smoker's health but also to other people. Thirdly, from the let's say we talk about the bottom line is the cost factor. It's back to the employer. Rather you happy with your smokers who suffers from, in the long run, with health problems and so on, cancer, lung disease, COPD, and people can still counter. Yeah, normal people can still suffer from COVID-19, not only smokers and other things. But why we need to, I think that there's a lot of things that we need to look not only solely from the for the companies to make revenues, but other benefits from health perspective. For example, the increase of productivity, the increase of morale among workers. For example, if you sit near to a smoker, maybe in a room, let's say for 10 minutes, will you be comfortable to sit besides a chain smoker in a room? I don't think so. Thirdly, if you go to the basement of the building where usually you have parking lots, parking spaces for cars or vehicles, and we tend to see many workers or whoever comes to the building and they will smoke there. Will you be comfortable to be at the basement of the building? No. You'll be able to play ping pong at the basement? No, because of the poor quality of air. There is a study in 2015, if I'm not mistaken, or 2013 or 2015 in Malacca, when the Ministry of Health worked together with the state of Malacca to introduce smoke-free Malacca in 2010, and Malacca became the first state in Malaysia to gazette 5 areas to become smoke-free, gazetted under the law. So the study conducted by University Science Malaysia, supported by WHO and ITC, International Tobacco Control Alliance, find out there's improve of air quality in many areas in the gazetted, the no smoking gazetted areas in Malacca, including restaurants, places of interest, tourist attraction, and so on. And thirdly, I think in terms of, if we can equate smoking to, I have spoken about air pollution. Every year we have this problem of haze. We have to use face masks. We have to stay indoors at many times. We have to, school has to be closed. If, that's before the pandemic. So, if we, and the air particles in the haze is much bigger than the air particles produced by smoking, and as you know, that the air particles produced by the smoking through secondhand smoke can infiltrate our lungs into our air sacs and so on, which is much hazardous to our health. So I don't think so. Any employers who really thinks about the safety, health, and also the well-being of their workers really wanted to. And for example, if you have, I think another example. If you can stay non-smoking in a long-haul flight from KL to Los Angeles, without, you can stay that for non-smoking for 15 hours, why don't you just stop smoking?
Yeah, that's very, very true.
And during the month of Ramadan, you can stay clean without smoking for more than 12 hours. So just imagine our brothers who live in Norway, who have a long summer day, for example, or in Europe, again fasting for 20 hours and without smoking. So there's some challenge that we should be ashamed of ourselves, because in Malaysia we have relatively short fasting time, not more than 13 hours. So I think we can do much better than that as a Muslim, for example, and as a Malaysian who really cares about the well-being of our country. So I think this is something, and if New Zealand can do it, why not Malaysia?
Yeah, very, very true. Thank you very much, Encik Wan. I think that's very important. I mean, you mentioned, you mentioned about the short-term as well as long-term implications, negative implications to employers, to employees, to the families, and Encik Wan also mentioned several suggestions or interventions that can be done, roles that can be played by employers to address this issue. So hopefully we'll get more employers or business owners to participate or to be more proactive in promoting this campaign that is being promoted by the Health Ministry. If you can move to the second question, Encik Wan, the next question is, you mentioned earlier about some of the interventions, if possible, to do in the next phase of the study. I think that would be very interesting. The fact that based on the study that was done, there were behavioral gaps that were identified. For example, what do you think, or if there is, if you can share any of the suggestions in terms of possible interventions that that can help to improve the effectiveness of this particular campaign?
The intervention that we focus under this behavior insight is how, from the study, how we can frame our messages is much more meaningful way, and much will be touched to the hearts by the millions. I just give you a simple example. Usually, if you look in the past, we have this Tak Nak campaign. I don't say it as not successful. It has some measures of success. Later on, we associated disease with smoking and so on. And we are still learning of how to improve our messaging. Perhaps we can also look at how other countries doing it. For example, most probably say, why don't you look at the public messaging in Thailand? For example, if people are, even you agree with that. For example, they use this very subtle messaging, you didn't realize that you have been a sort of, it's not humor, but it touched deeply in your soul. For example, one of the advertisement which won the Cannes Award in 2015 or 2016, if I'm not mistaken, where two kids come to the smoker and ask for lighter. And when the smokers ask back to the, why you want to ask? Because the smoking will cause you harm, you will not be able to reach old age. So the kids ask the smokers again, so why do you smoke? And it give a sort of sentap or snap, something like that.
Very, very deep message.
And later on, the kids give the message in a folded paper or a letter to the smoker that, why don't you get help? So go for the call this number or go to this smoking cessation clinic. So I don't say we are lacking creativity, but I think the best messaging which reflect the soul of Malaysian. So I think we need to look into it. For example, we are not only talking about celebrities or icons, but sometimes simple messaging, for example, maybe we can use the family sentiments. If you love your family, why you smoke? And something like that. I'm not that good with creativity. So this is where we can improve on, and we can refer back to the study recommendations that rather than using fear and humor or prank, for example, we can use, we can instill emotions and also touch to the soul in our message framing. So this is where we can learn, and this is still a long way to go because we want to target Malaysia to become a smoke-free nation by 2045 or earlier than that. So we must work together and try to achieve this for our nation.
Okay, thank you very much, Cik Wan. Very, very useful answer to that regarding the importance of messaging, framing the right message, delivering the suggestion there is using emotions to evoke certain emotions, to touch the heart of the smokers. The third question that we have here is perhaps from Cik Wan from the Ministry of Health, the education health education division. Maybe if you can offer some advice or tips to either to the, maybe one is to the family members who are close to the smokers, what kind of message you will tell them, and another one maybe to the public as a whole in general. If you can offer some advice or recommendation, suggestion based on your experience.
Okay. For the smokers, I would like to, maybe I can bring some sort of history to how smoking comes into being. If you remember in history when during the Renaissance era in Europe, when Portugal became the world power, Spain became the world power, become the superpower. So one of the measures where they want to enhance their influence in the world stage, the Spanish sends 3 ships under the command of Christopher Columbus. So the mission that's been given by Philip and Isabella of Spain to Christopher Columbus is to find India. So Christopher Columbus did find India, but in the wrong direction. So they find West Indies, which is in the Hispaniola. So when Christopher Columbus landed in Cuba, if I'm not mistaken, or in Cuba, in which Christopher Columbus never ever stepped into the continent of North America or South America. He only managed to find his way around the Caribbean. So one of the things that he found from the native is surprisingly, the tobacco plant. So the tobacco plant has been used by the native as for the medicinal purpose, for the pengawet, as a preservative, as the way of getting high or something like that after a long day of work in the field or something like that. So and after few years, started merely as a barter to barter trade, and later on the Europeans become more greedy, and later on the natives become the slaves, and they have to harvest the tobacco plant. You just imagine that tobacco smoking is the enslavement of human being. Rather you agree with that. If you agree with that, it means that you agree with slavery. From the viewpoint as a Muslim, the National Fatwa Council has come out with a fatwa in several years back that smoking is haram, non-permissible in Islam because of the ill effects on health. I will not digress further why. All the experts in the field of health has spoken about it. It's up to you, but please think about your loved ones. Smokers are also humans. They have families, they have friends. So if you love your families, if you love your friends in your workplace, if you love families on your tennis court, in football games, if you want to go for anything together with your family and think the ill effects of second-hand smoke and third-hand smoke, that this will bring the negative, in the future, it becomes very detrimental to the health of your child, for example. They will see, as I said about Albert Badura, that the youngsters, the kids learn from what the behavior of the adults. So if they see the grown-ups, growing up, seeing their father or a family member smoking in the house, it becomes a norm for them. We are talking about new norms nowadays, wearing face masks and so on. We couldn't let our children to teach our children that the new norms is smoking. So this is not. And since the early days of the pandemic last year, when we cannot go to work, lockdown, so the smokers find out it's very hard for them to smoke in the house because the close confinement with the family and so on. So why don't we stick to that as a new norm and practice that for the whole of your life? If there is a really doesn't your gian to really gian lah. You cannot kick off the habit. Go outside the house, find a place rather than, but don't go to restaurant to smoke. So go find a place where there's no people and don't smoke in front of the people. So I think that's my honest advice to all smokers. And for the vapers also, please stop using the device because we are not so sure. The study is still going on, and we don't want our future generations to become a dual user. So this is something that not healthy for our nation. And as I said earlier, using e-cigarette or vape, although the vape producers and what you call the vape mechanisms, they claim that they are only using juice, but we doubt because it may contain, if you look at the labels, it may contain nicotine. You just imagine inhaling nicotine steam directly into a smoker. Only inhale the smoke from the burning of the cigarette, the nicotine and tar inside the cigarette. But for the vapors or e-cigarette, they are inhaling the liquid nicotine steam or vapor from the burning of the liquid. So just the heating of the liquid. So just imagine, if the liquid comes directly, it will cause severe damage to your health, permanent damage to your health. So this is my honest advice to all of you.
Thank you. Thank you very much, Encik Wan. Encik Wan has given a very broad perspective from various dimensions. From historical perspective, from religion of Islam perspective, quality of life, relationship, the importance, the effect of smoking to our ability to have quality of life in terms of sports, recreations, relationship with our family members, as well as family values. Unfortunately, that's all the time that we have for today. Thank you very much, Encik Wan, for giving the talk today, sharing your valuable talks on a very important topic. Hopefully, all the participants who are able to join us today benefit very much. I know I, as a moderator, benefit very much from your session. We thank you again for all the participants for joining us today, as well as MPC, Malaysia Productivity Corporation, who has organized this National Conference on Behavioural Insights 2021. With that, Assalamualaikum and a very good day to everybody.
Waalaikumsalam warahmatullahi wabarakatuh.